Joining us now to talk a little bit about behavioral health during these days of COVID-19, Dr. Ava Boswell is on the phone with us. She is with San Juan Health Partners Behavioral Health. Good morning.
Good morning.
Thank you for joining us. And so let's start by talking a little bit about what you are seeing with patients that are coming into your office or calling you about behavioral health. How are folks dealing with things these days?
Well, thank you for having me on. I greatly appreciate it. These days, we're actually seeing an increased level of depression and anxiety in the people who are coming in. A lot of people who might have, minor mental health issues, having some increased stress over things, work stress, life stress, stress with kids, have found that being home due to COVID and also having significant changes in their daily routine is causing increased stress and depression in some people. And what we're recommending is that, if you are experiencing that you call in, come into the hospital, either come in, make an appointment with our outpatient behavioral health and get care early. San Juan Regional is really dedicated to giving you really good care. They have a lot of appointments that we can arrange that are either by telepsychiatry, where you're seen through video for the first appointment, and some appointments in person, so that we're encouraging you to basically get care early rather than later. So that, you're taking good care of yourself, you're taking good care of your family, and understanding that this is a very, very stressful time for most people. And even people who don't normally have mental health issues can have depression and anxiety in times like this where there's increased stress.
Great. So if I was an individual that, has never struggled with mental health issues, so might not know exactly when I should reach out for help, what is your suggestion there?
When you start feeling overwhelmed and you feel like you're maybe not functioning at the normal level that you would, some people are experiencing significant trouble sleeping, increased worry where they just cannot stop. They have, thoughts of worry running through their head. I've always considered anxiety as just an increased sense of worry where you have thoughts running through your head about the things that you need to do or can't get done. If you're having increased fear, some people are very afraid to go in public, afraid to leave their house, really afraid to engage in their, previous routines. We're encouraging everybody to wear a mask, to, take all of the precautions that, social distancing precautions. But if, you still have an underlying level of fear about going out in public doing those things, reach out. And or if you're just not functioning at the level that you previously were, for example, struggling at work, struggling engaging with your kids, if you have kids and you're struggling with helping them get their homework done, struggling with the new education platforms, any kind of a change from your baseline life that you're not handling well is when we would suggest that you reach out. And for a lot of people, they don't need medications. They may just need to talk to a therapist once or twice to, discuss what the issues are that are going on and just get an extra ear to release the stress. And other people who have significant issues, we might suggest an antidepressant medication, just something to help with decrease the anxiety and stress level and get you a little help to get you on a healthier, back to your normal health.
Understood, Dr. Boswell. Thank you. And I wanted to ask you a little bit, too, about children, because I think we are seeing maybe some more cases of stress and depression amongst kids, and maybe harder to see. And is it harder to deal with? Can you talk a little bit about that?
So for kids, very definitely, it's a good thing to watch how your kids are functioning and whether they're having sleeping problems, whether they're having more emotional outbursts and episodes, if they're crying more, if they're fussier, or if they just shut down and become very reclusive. All of those are signs that your kids are struggling. They may be having depression and anxiety as well. Some of the tactics with kids and how to help them are, just really explaining what's going on, and trying to understand, see through their view what they're experiencing. Some things that you can do to really help support them are to keep them on a schedule. Kids run great on schedules, so that if they know the next thing that's coming and the next thing that's expected, those things are very helpful. Even write it down on a whiteboard and have the schedule for the day. From 9 to 9:30, we're going to be doing this. From 10 to 10:30, we're going to be doing this. Also, keeping them active, getting them out of the house, with the proper safety precautions of, the masks and the social distancing, but taking them to the park so that they get some fresh air, get out, or able to run and exercise. Those are all very important. You can also do coloring and art projects with your kids to help relieve the anxiety. Those are some great things. There's also some kid online yoga programs that you can find on YouTube. And especially just getting your kids engaged in healthy activities around the house, helping them, creating a garden, helping them engage in healthy things that aren't necessarily in front of a screen, so that they're active, they're doing something that's keeping them engaged and limiting boredom.
Very good.
Things that you can do.
That's very helpful. I want to talk a bit about habit formation here, because a lot of our routines and habits have suffered because of this strange time we're in. And so let's talk about maybe suggestions for replacement habits, or what kind of habits can we form during this time that would be healthy for us?
So some of the things are actually habit formation. You can really integrate coping strategies in habit formation. Keeping yourself on a schedule is really good. Also, reaching out to the people who you used to be in contact with. For example, if you had a group of friends that you used to see on a very regular basis, make sure that you stay in contact with those people. It might be different than seeing them regularly, but, talking on the phone, doing a Zoom meeting, something like that, so that you still do have that social interaction. It might just be a little bit different. Also engaging in different hobbies, knitting, crocheting, if you're a woman, any kind of a hobby that is a healthy, sometimes woodworking, exercise, sports. They may not be group sports, but individual sports are really good things. Even if you can only do it 3 days a week for a short time, that will definitely help. Also, journaling and meditation. Journaling, a lot of people are finding that that's really good to just track what's going on, because this is an unprecedented time in our country and an unprecedented time of stress. And so journaling is a really good way to capture what you're feeling. Also, the routine of having good sleep hygiene is hugely important. And what I mean by that is that setting a bedtime and then making sure that you get a routine where you don't use electronics a half an hour to 45 minutes before bed. Making sure that you have a routine where you either take a shower, brush your teeth, brush your hair, get to bed and read a book. Use something without a screen and give yourself about 30 minutes to fall asleep. Your body runs on routine, and getting good sleep is a very huge part and a foundation for the basis of our life and for our mood. And so incorporating that is hugely important.
And Dr. Boswell, talk to me a little bit about maybe if we're seeing maybe problems with others in our friends or family circle, that maybe they are suffering from depression, or maybe they are having some difficulties. Are there any signs that maybe the rest of us can look for? Because many times it seems like someone has been depressed or someone's not doing so well, and we want to be available to them and help them through this, but we don't always pick up on the signs. Can you offer any advice for that?
So one of the things is just being very aware of the people that you're around and connecting with them and finding out how they're doing. And if they are becoming, more reclusive, they're not as engaged as they used to be, you're having trouble connecting with them, those are all, warning signs just to check in to say, how are you doing? Because a lot of people suffer in silence, and that's what we want to try to avoid, getting somebody who's being more reclusive, not engaged in what they used to do, and won't reach out for help. And if you do see that, it's good to talk to them, encourage them to come to San Juan Regional and get some help, talk to a counselor. We also have, I definitely encourage that everybody have, the suicide prevention hotlines. New Mexico has a very good one. It's 1-855-NM-CRISIS, and they're 24 hours a day. Somebody's there to always talk. There's also like Talkspace is one. There's some apps like Calm and Breathe and Headspace that you can get on your phone that you can even, help your friends engage with so that they have an outlet. But the main thing is being present for the person that you're really concerned about and helping them through that process and encouraging them to get help.
Right. And of course, that in normal times would be maybe a little easier to do. But these days when we're not maybe seeing them regularly and we're not interacting with them regularly, I mean, I think I get what you're saying is that we need to get into the habit of maybe even picking up the phone and making a good old-fashioned phone call to check in on these folks. It's about that easy, isn't it?
Yes, very definitely. That's exactly what I'm suggesting, is that if you haven't heard from a friend in a while and you haven't seen them, reach out through telephone, through a text message, through an email, even through social media if you're engaged in that, to check in on them to see how they're doing. A lot of people just a simple text message to check in to say, how are you doing? It can make the difference. A phone call, even if you can't get a hold of them, leave them a message. Those little acts of kindness are really what can change the course of somebody who's having some issues, struggling, is that they know that someone out there cares about them, and that's huge.
Yeah, very good. Well, Dr. Boswell, we thank you so much for your time. We know that things are busy always for you guys, and especially maybe during this time, and so thank you so much for coming on.
I just wanted to stress that San Juan Regional is here for anyone who needs care. They are ready and safe to provide care. They have changed some of the protocols. We do expect everybody to come in with a cloth mask. They're mandatory. Visitors will all be screened for symptoms because we want to keep things safe. And for appointments, they can either be in person or online. And they have definitely done everything that they can to make sure that there's care available and that it's safe care. And so if you have any questions at all, you can definitely reference the website at sanjuanregional.com. And if you need behavioral health help, please reach out to San Juan Behavioral Health Partners.
Very good.
And be kind to yourself and others, because we're all in this together.
That is very true. Dr. Ava Boswell, thank you so much for joining us this morning. We appreciate it very much.
Thank you so much.
You're welcome.
Okay.
Dr. Ava Boswell, San Juan Health Partners Behavioral Health, our guest here on KSJE. And we are back here in the studios this morning, Scott Bickman along with Megan Collop, and good information.
Great information.
Because, again, behavioral health, mental health, a big deal during all this. And I think folks may not realize maybe the impacts that this shutdown and stay at home and don't socialize are really having on people and their families.
Because as she touched upon, it can be a very sort of insidious thing that's going on in the background until people sort of hit a brick wall. And so they miss a lot of early warning signs.
Right.
So that was really helpful for her to, dig into.
Explain all that. That's right. That's very true. We have our next guest on the line, ready to go. And Jeff Bourgeois, the president and CEO of San Juan Regional Medical Center, is joining us for an update this morning. And Mr. Bourgeois, again, thank you for calling in this morning.
Hey, good morning, Scott and Megan. Sorry for being a little tardy, but it was great to have the chance to listen to Dr. Boswell. She did a great job.
She did a lot of great advice from her, and that's okay. You're not tardy at all because you're here right now. So we appreciate you being with us. Can you give us kind of an update on conditions at the hospital this week? We are hearing, Jeff Bourgeois, that the cases are down in San Juan County. Daily numbers seem to be down. Our state numbers seem to be heading in the right direction. Is that what you're seeing there?
Yes, very much so. We continue to see a decline in the overall positivity rate, the overall inpatient census related to COVID. It's bouncing around anywhere between 5 and 15 right now. Kind of goes up and down. We actually we're down to below 5, I believe, for one short period last week. So we continue to see that decline, and hopefully it stays that way. Everything else is going well. We have our elective schedules open. We have 20 cases, OR cases scheduled going into today, and I'm assuming as normal it'll probably increase with add-ons in emergencies throughout the day. So pretty busy day on the procedural side for us. What we have seen, and it's not unique to us, in talking with colleagues and reading industry newsletters, is that emergency department volumes continue to be way down from pre-COVID experience. And that concerns us in that people perhaps are not seeking care when they may need it. So I think Dr. Boswell's points about, come to the hospital if you need care and don't delay an emergency.
Sure. And I'm sorry to interrupt, Jeff Bourgeois, but I wanted to ask you about that emergency department numbers. Could part of this, though, be that we're just not moving around as much? And if we're not driving around, we're not crashing into things as much as we used to, and we're not having to go to the emergency department? Is that maybe some of this, or is it hard to really track down what could be the cause?
Yeah, I would hope that would be part of the answer, Scott. I hadn't thought of that. But we really just don't have any really any evidence about what it is other than anecdotal reports, widespread that people are coming to the hospital oftentimes kind of late in the course of an emergency, delaying care for stroke or heart attack interventions, and that's never good.
Sure, I understand. And that certainly would be something I know you and the other folks at the hospital we've talked to have been stressing, that we shouldn't be delaying any visit to the emergency department or urgent care if we feel we have a health problem. So I definitely understand that.
Yes, and I have a question about, as COVID cases go down, the hospital obviously has designated a whole COVID floor. As those cases decrease, is that space going to be transformed again into something else what it was originally used for? Or is that space going to remain preserved in case there are these like second and third waves?
It's a great question, Megan. What we'll do is, until such time as COVID is behind us, we're going to designate a portion of the fourth floor as a respiratory unit. That will be the fourth floor ICU and what we call the fourth floor central part of our medical unit. That has 19 beds in the non-ICU setting and 14 in the ICU setting for a total of 33 beds. We can expand into other parts of the fourth floor if we need to, if there is a significant subsequent wave. And what we're learning, along with other hospitals, is that, with the flu season just around the corner, of course, we want to really stress everyone to go and get a flu immunization as soon as they become available here in the coming months. But respiratory patients will be, we will share the same precautions for infection control and isolate those patients all in one area in the hospital.
Great. And I have a question about the visitor policy. That's kind of, that's been changing, but the last time we heard about that was a little while ago, and I believe it was one person a day. Has anything changed with the visitor policy?
Not yet, but we do have that under review. Of course, we would like to we would like to loosen that up as soon as possible, as I'm sure patients and family members would as well. But we're just using an abundance of caution. Family members can also, they're an important part of the healing process, as well as just being able to, offer support care there to their loved one at the hospital. So as soon as we can, we will loosen that up. But no changes as of today.
Got it. And Jeff Bourgeois, you mentioned earlier about some increasing activity in the operating rooms there at the hospital. Is this something that we're seeing, maybe elective surgeries coming a bit back more online, and folks are maybe opting to do some of these things that they put off when you weren't able to offer some of these elective procedures, or is this something different?
No, that's exactly it, Scott. Getting back into the routine of normally scheduled elective surgical procedures.
Gotcha. And we haven't talked a lot about PPE or those types of things, but we're hoping the supply chains have kind of replenished themselves, and the hospital is able to now acquire all the PPE that they need. It seems like that's part of the dashboard criteria that the state is monitoring about the gating criteria. Is that true at San Juan Regional? You've got all the gear and materials that your folks need on the job every day?
Yeah, we're in good shape with PPE, Scott. And thanks to the team that's been managing that, we've maintained an adequate supply of all the key items that caregivers need to protect themselves.
Very good. Well, Jeff Bourgeois, we appreciate your time, of course, and the update every week. And it certainly, we appreciate talking to you once this is behind us, and we don't talk to you for a while. We'll miss you, but we'll look forward to that, if that makes any sense.
Yeah, it does. Well, listen, you all have a good day.